In my frustration, I remember thinking, wait a second, why are we using an analog metal ruler to measure something so precise? In the midst of all this high-end medical technology, why are we still using an archaic, antiquated system? Hello, my name is Dr. John Kim. I'm a practicing surgeon at Northwestern University, and I'd like to talk to you today about this device. This is the electronic depth gauge. This is a device that had its genesis over 20 years ago, and I'm proud to be able to say that I was part of its founding. I still remember that day. It was in the OR, and I was doing a distal radius case, and we were struggling because we were trying to precisely measure the screw length that was needed for this plate that we were placing to fix a broken radius. The issue was that when we were trying to measure the screw depth, it was not possible to accurately measure it. And as you might realize, in surgery, accuracy, precision is key. And immediately my mind thought to thermometers. When I was growing up, we used to measure temperature medically, clinically, with mercury thermometers. And that became obsolete because we were able to more accurately measure using electronic systems. So that was the basic idea. And it's something that when you start out as an inventor, you're just seeing something that's a problem. You're having trouble giving your patient the outcome you want. So you're laser focused on creating a solution to that problem. And ultimately the goal, again, is what the genesis of this device was for me initially, which is how do we get better patient outcomes from what we do? And I'm proud of the team that has helped to bring this here. Although the genesis of this was to deal with the frustration of having inaccurate, imprecise measurement, the outgrowth was an entire technology platform that not only measures more accurately, but also has other features as well. And the problem is that with these instruments that have to go through a process of sterilization, something called autoclaving, the critical part of the measurement member here that we can see here that's called the depth gauge probe, this would get bent, and this would also potentially get contaminated. And that's one of the things that I realized is that we could also do away with some of the issues related to sterility and infection control. This can also enhance logistics. So there are some efficiencies that are built into getting better measurement. Number one, you don't have to pull out a screw and re-input it. It improves patient outcomes by decreasing the surgical time that a patient is under anesthesia. Other logistic benefits are that because this is a universal depth gauge that can then be applied to different sets. From an OR perspective, if you have a depth gauge, an analog depth gauge that may be missing or maybe the wrong depth gauge for a particular set, this obviates that issue. In essence, this idea has germinated, has evolved over more than 2 decades, and now I'm proud to hold what I think is the paragon or the pinnacle of measurement. The dream, the genesis from that initial frustration in the operating room can be translated to something that helps across patients, across hospitals, across surgeries, across surgeons. I'm thankful to have been part of that journey of innovation, and I'm hopeful and optimistic for a brighter future.